Yes. Thank you so much, our viewers, for again continuously watching our videos. Today, we want to talk about some other common traditional and cultural behavior, which I know most of the people are doing, but is not so much documented in our books that we study. That is infant mutilation, or you can call it infant oral mutilation, or what we call false teeth. What are false teeth? Some people will call it false teeth extraction. We shall call it false teeth extraction, but we shall put false teeth inverted commas because we don't have false teeth. What is this habit? In Uganda here, or in East Africa, most of the Bantu tribes call it ebinyu. Ebinyu, and you hear people saying, yeah, he's suffering from ebinyu, or they have done ebinyu extraction. But what is this ebinyu extraction? Or what is this false teeth? I'm saying for us dentists, or for us, what we know is all teeth, whether permanent or primary, are teeth. But the word false, we put it in inverted commas. So false teeth does not exist. So what is this practice called false teeth extraction? There are very many theories about false teeth. Some people do not know, we do not really know even what causes this type of condition. But what we can say is that false teeth, or this so-called ebinyu, can happen at 6 months or 8 months of age of a child. It can happen at 1 month. It can happen at 2 days of age. But whichever way, we shall know that even if somebody gets this problem at 2 days, at 6 months, at 1 month, it all remains primary teeth. And the primary teeth, we say those are teeth which someone has that will later be replaced by the adult teeth, or what we call permanent teeth. Ideally, or in the normal way, somebody should develop permanent teeth, rather primary teeth, at 6 months of age. But some children develop them at 3 months. Some of them develop them later, at 7 months. So if it comes early at 6, rather at 3 months or 2, or even 1 day, or if it comes late at 9 months instead of 6, they all remain primary teeth. So the common explanation of false teeth, or which the type of false teeth which is very common, is the one which I'm going to explain. But I'll also comment on the one of 2 days, or on the one of 1 month. Usually, the common one is the one which is around 6 to 8 months of age. I already said that a human being or a baby is supposed to develop teeth at 6 months. But it can come early, or it can come late. So, you shall remember that when somebody is born, he has 100% immunity. The baby has immunity 100%. But as somebody grows, the immunity reduces. So as it reduces, the baby is growing. So 1 month, 2 months, 3 months, after that, the baby starts now crawling. You know crawling. crawling, walking with 4 legs, or you can the arms plus what? Some people kneel down, some people crawl when they are seated, as they are putting their what? As they are seated, as they are crawling, or some people use what? The knees, or in any way you crawl. But what matters is that they are using hands to touch down. So as somebody is crawling, crawling, at this time, remember, it is crawling time. The body immunity is reduced. But again, thirdly, at this very time is when we have development of teeth. And development of teeth is when we have eruption of teeth. Eruption of teeth is when the teeth are coming or are moving from their position in the jaw to the position in the mouth. At that moment, it is associated with eating. So as the baby is eating, as the baby is eating, the baby is growing, and the immunity is what? Is lowered. I repeat, the baby moves from one place to the other. As he moves from one place to the other, the gum is eating. So he scratches the what? The gum. Using the hands that have been touching on tiles, on the ground, on surfaces, on whichever part of the what? Of the, but I do not think there is any way how you can handle this baby in order to touch the ground or touch contaminated what? Surfaces. So from that point, you shall have the baby eating in order to soothe or to reduce the what? The eating. So what happens? At this moment, we are going to have the gum soil. And remember, he has been touching down, he's picking infections to the what? To the oral cavity or to the mouth. We shall have diarrhea because the infections are setting in. Vomiting. From there, loss of appetite. The baby does not have what? Appetite. There is a rise of temperature because of the what? The infection. All those ones will scare the what? The mother. So what does the mother do or the father do? Running to the witch doctor. When the baby runs, when the baby is taken to the witch doctor, when the baby is taken to the witch doctor, when the baby is taken to the witch doctor, what happens is that is going to be subjected to very harsh treatment. Remember, when these people who remove these false teeth in the brackets, but which are real teeth, these people usually have not learned science of human beings. Because they are going to tell you some old woman somewhere under the tree is going to remove the what? These false teeth. And some people say they are maggots. This person has not given injection to reduce the what? The pain. He has not learned, he's a quack, he has not learned anatomy, he has not learned where the nerve is, where the blood vessel is. So he's just using force, he's just using lack of knowledge, he's just using lack of experience in order to harm this child in a way of helping. So what happens is that they are going to use bicycle spokes, knives, long nails, which are not sterilized. These instruments they are using are not sterilized, and they are using force because the child is not what? Anesthetized, or they have not put anesthesia or injection to stop pain. They force these knives or these sharp nails into the gum of the tooth or the gum of the child. So what happens that all these things, remember these knives are supposed to be sterilized, or anything which touches a human being is supposed to be sterilized. Now what happens is that there is no sterility, or the things are contaminated. Someone here can get infections. You can get tetanus, for example, because for all things which touch, even if you get an accident, the thing they first do is to give you what? Tetanus toxin. But here, if someone has got such a problem, you are using knives which are not sterilized. Nails which are not what? Sterilized. You can even pick HIV because they have used it from another person. It's not sterilized. They are putting it in your what? In your innocent child. In cases of COVID, someone can pick COVID. In cases of any infections, it can be picked from one person to the other. There is also what we call dry socket. Dry socket is an infected wound. When you remove a tooth and the wound is infected, we call it a dry socket. This one could also happen, but those are short-term complications, or those are short-term disadvantages of this topic, of this practice. But there are those long-term ones. For example, when someone gets this, is subjected to this type of treatment, they are forcing a knife or a long nail into or near this gum or near this tooth. But if it goes deeper than that, you remember now the primary tooth, which is so-called the false teeth, is being removed. But if they go deeper, they may not only injure the primary tooth, they can also destroy or injure the permanent tooth, because under every primary tooth there is the seed of the permanent one. We call it a germ of the permanent one. So under every primary tooth there is what? A permanent one. So they injure the primary one, they injure the permanent one, and they can even destroy what? The jaw. Because this is a child whose tissues are still soft. Someone can injure it unknowingly. So that one can lead to absence of a primary tooth, or the primary tooth does not exist, as you're going to as you see in the photo. You can also find later in permanent teeth. Some of us will find that you don't have these teeth and you wonder what happened. This resulted from your parents taking you to false teeth extraction, what we call infant mutilation. So this one can also bring what? A problem. It can even lead to teeth being deformed. And these deformed teeth, lack of permanent teeth, lack of primary teeth, are usually in the area of the canine region. You shall find some of the people they do not have a tooth in this one, in this area. This is a result of false teeth extraction. This is not a good practice, because as I have said, people in adulthood may lack teeth, both primary and permanent, may have deformed jaws, or jaws can be what? Deformed. We can also have teeth which are what? Which are not in the right form because of being injured by these quits or quacks. Ladies and gentlemen, in case you are having a child who has this type of problem, even if it is after one day, you deliver today, the next day the child is having this so-called false teeth, what did you do? If it is 8 months, what did you do? If I know many doctors do not do this, but even if you are a doctor, even if you are a non-medic, but we are saying the most important thing to do is not to go to false teeth extraction. The most good thing to do is to treat signs and symptoms. Someone is going to tell me, is that a solution? Yes. We did it in COVID. In COVID, we treated signs and symptoms. Those with flu, those with congestion, those with fever, we are giving IV paracetamol to remove the what? The fever. Those of headache, a painkiller. Those of congestion, steaming. This is how we are supposed to handle false teeth in court. In case somebody has this problem, take to the nurse, take to the doctor, take to a medical doctor or trained personnel, trained dentist, but you are supposed to handle signs and symptoms. What are these? Vomiting, handle vomiting. Loss of appetite, handle loss of appetite. Fever, give medication to remove the fever. Raise temperature, all these. Diarrhea, give anti-diarrhea what? Medication or drugs. Ladies and gentlemen, this is false teeth extraction. But we are saying false in inverted comma because they don't exist. All of them, leave them untampered with. Don't remove those teeth just because you think they are what? False teeth. Leave them there and treat signs and symptoms. But most importantly, take them to a hospital to seek medical treatment. Thank you so much for watching. In case you think this video is very important, share it with your colleagues. Subscribe to our YouTube channel for the next videos. Thank you so much.